The meeting of the Finance Committee will begin, allowed by the emergency from the governor. I need an approval. Could I have a motion to approve the minutes of January 26, nicely presented by Councilor Peak?
So moved.
Second.
We have a motion and a second to approve the minutes of January 26. Any further discussion? Hearing none. Councilor Peak?
Aye.
Councilor Denham?
Aye.
Councilor Riss says aye. Public speak. Anybody here to speak? The mayor's not here, so we'll go to public speak. Anyone? Okay. Chris, since we're missing people, I'm going to jump to you. You get the lucky choice here. We did this for the police department. I'm assuming this is exactly similar. You have all of these items that were not covered by the budget, and we're catching up using free cash to catch up. Is that correct?
Yes, sir, that's correct.
Wait a minute. So I heard that there were other expenses that you could cover using FEMA or COVID funds. Is that true?
Yes, I can explain those more in detail when you're ready as well.
Well, you could do that now. I just want to make sure that this is enough to cover what you need.
So when I submitted the initial appropriation, it was reviewed by the mayor and her financial team, and they sent it back, and I basically went through and pulled out all of the COVID-related expenses. So, for example, one of the initial appropriations had on there $30,000 for EMS supplies. And what we did was we backed that out. We went through and looked at those supplies over this past fiscal year that were focused for COVID-related responses. So, for example, anything particular that was related to respiratory, breathing issues, oxygen equipment, things of that nature, IV equipment, we were able to back that out. Since this appropriation was submitted, I resubmitted those documents to the mayor and her financial team. We also went back and looked at, in particular, EMS overtime. And this one was of significant importance. What we've seen happen since September over the entire healthcare system, including the hospitals, was a huge increase in call volume, which then created a cascading effect and a backlog. I've got emails from both Cooley-Dickinson Hospital and Mercy Medical Center, and also Bay State Medical Center, where they have the term called holding the wall. And since September, based on this backlog, we would transport people to these healthcare facilities, whether they were COVID related or not. And instead of being able to transfer care over to their healthcare personnel immediately and then return back to service, we were down there for an extended period of time waiting for their personnel to become available and free up an actual room so they could then accept our patients. What that created was then obviously a greater lapse in our coverage back here in the city of Easthampton. So we actually changed, based on my direction through the dispatch center, our recall policy. So now, anytime since October 1st, anytime an ambulance transports a patient to a hospital other than Cooley-Dickinson or Holyoke, I treat those two hospitals as kind of in our service area, and we can hopefully get back quicker based on travel time. But we go to Bay State an awful lot. We go to Mercy Medical Center quite a bit, and every now and then Noble. Anytime we go to those healthcare facilities, we recall two people automatically, knowing that we just lost two healthcare providers for upwards of 90 plus minutes. So that's why you've seen since this fall a slight spike in EMS callback overtime. And then the last one the mayor asked me to back out also was our shift overtime, again, related to COVID response. We've actually been very fortunate this past fall We've had great protective measures. We've got great protocols and procedures in place for protecting our personnel. One thing I will comment to this group, and I try to, when I speak to all the counselors, certainly this past fall, the region saw a significant spike in COVID. And the thing that can't get lost is the fact that we're the EMS personnel respond to these people with these respiratory disease and are COVID positive. And then they're in the back of a confined space that's basically 5 feet by 6 feet for upwards of 20 to 40 minutes, depending on where they're transporting them. And when we looked at our numbers, we didn't have too many people out, but it could have been much more significant if not for the proper PPE that we were able to procure and provide to these individuals. So with that, I backed out the shift overtime when we had people out related to COVID, and then we had to backfill based on the contractual minimum of 5. And that number, the mayor and her financial team have that as well. That was around $15,000 up through the end of January. So right now before you with this financial transfer, we really did our due diligence. We backed out everything related to COVID. In terms of the shift overtime, I'm very happy and proud to report that we're tracking that on a weekly basis. And right now, for our shift overtime compared to last year, even with COVID, we are $28,500 less than we were at this same time last fiscal year. And that really is attributed to a number of factors. We're able to work with the mayor and get up to full staffing when we lost a few people towards retirements. So that minimized the need for overtime. We changed our operational procedures. Prior to my tenure at Easthampton Fire, there was a history of sending people to the fire academy, particularly during the summer months. And what that created was, again, a cascading effect where now you have people gone to the fire academy who can't cover shifts during the peak overtime periods of July and August, which then escalated and increased the overtime costs. So we changed it around. So we held people from going to the academy until mid-fall, when vacations were kind of slowed down a little bit and didn't create as much overtime. So those are just a number of factors that, again, help to minimize that. And then certainly the last one I just want to mention, with the creation of that fire training officer position and the way we structured that, we're now able, when we have a shift captain out and that training captain is on duty, instead of hiring overtime to backfill that shift captain, that training officer captain slides over and covers that daytime response, saving 10 hours of overtime each day that they cover. So there was a number of factors, both procedurally, operationally, that put us in this position, at least compared to last year, where we're doing very well.
Chief, I'm just so excited about how you've managed your budget, and I want to thank the mayor and her financial team for discovering that we can cover overtime and other items out of COVID funding and FEMA funding. It helps the city. Obviously, these particular expenses that you list here are just to cover budget shortfalls that we expected. So I have no questions except to thank you and the mayor and Jen and everybody for this. For those of you that came late, I jumped to the fire department request because other people weren't here. Councilors, do you have any questions of the chief on this? Councilor Gomez, Councilor Denham, Councilor Peak? Councilor Peak.
You might have said this and I might have just missed it because I was taking minutes. After backing out the funds for the COVID related things, how much did that ultimately reduce the appropriation by?
So backing out the COVID related expenses, for EMS supplies, we backed out around 15,000. For EMS overtime and coverage, that was around 15,000. And for shift coverage, that was around 12 to 13,000.
So about 43,000 total.
42,000.
42,000.
So by backing those funds out, those were more specific to COVID. And then basically our goal going forward is to see where this plays out, contain the costs like we have been, like I spoke about with shift overtime. When we were budgeted for this fiscal year, as all of you are aware, we were budgeted at $100,000 in that line item for shift overtime. When you look back historically over the last 5 years, the fire department has averaged $235,000 for that line item of overtime. Obviously, that certainly is not our goal. We're in a great position right now. But I just want to at least keep it on people's radar that we just need to continue to manage this and just see where it plays out as we get closer towards the end of the fiscal year. The last thing I'll share to you is, just like any department, you always unfortunately have those unexpected expenditures. When this was submitted on January 26th, our frontline ambulance, A1, was taken out of service on February 1st, and it basically was not running properly. We had Dennis Ruthie and his team look at that. They brought it down to Marcotte Ford, and over the past few days, it was brought to my attention that it needs what they call a diesel particulate filter. And for that specific ambulance, which is our frontline ambulance, that's $6,600. That was not in this appropriation. Obviously, we're going to try to make it work like we always do. But that, again, just gives you a quick example of some of those significant expenses that were unanticipated. And of course, it had to happen about a week after I submitted this appropriation request.
Well, I also recall that I think the mayor had put more funds into the reserve fund or other funds to cover maintenance costs, because we don't know what maintenance costs we might need. And when it happens, it happens. Other counselors for questions for the chief?
And certainly, I just want to also, through the chair, I don't want to bring all bad news. One of these line items is $20,000 for miscellaneous and professional technical services. As people are new to this committee, that we have, when we do our ambulance billing, we have a contract with a third-party billing agent. They get paid 3%, it's 2.99% of what we actually collect. So I bring that to your attention because we're asking for more money specifically in that line item, because right now, based on our latest projections, for the first time, we're on track to collect over $1 million that goes to the general fund for ambulance receipts, which includes the contract with Easthampton and our Medicare reimbursement.
So we're in a good positive state right there.
Yeah, so it really, looking at that line item in particular, I always just try to have the conversation and education with everyone that we're really looking at reinvesting in this public safety service.
Anyone? Well, I think this is straightforward. I'd like a motion to move to the city council a supplemental appropriation of $325,200 for various fire department requests. Somebody
So
move. Tom moves. Second. Any further discussion? Hearing none. Councilor Peak.
Aye.
Councilor Denham.
Aye.
Councilor Rich says aye. So, Chief, this is up for public hearing next Wednesday. We'll need you there.
Yes, sir, I'll be there.
Okay. Now we're going to go back to the agenda. We had started. Barbara, you're up for the city council advertising. This is straightforward. We need to advertise because we have more public hearings scheduled than you anticipated, correct?
Yep, legal advertising is expensive and you guys have been busy. The purchase order that I have open for legal ad, which is pretty much your whole budget, has $47.07 left. So, and we have a bill for, I think, $120 some waiting or more, waiting to be paid.
Well, since councilors, this is for our council, I don't have any questions. Do either any of you have any questions or concerns? All set? Then I'll need a motion to approve an interdepartmental transfer of $2,000 from the reserve fund to city council advertising.
So moved.
Second.
We have a motion. Any discussion? Hearing none. Councilor Peak.
Aye.
Counselor Denham.
Aye.
Counselor Riss says aye. The next item is $20,000 to supplement legal services for the Union Street legal expenses. I expected this. Mayor, is this sufficient for you? I assume you'll have probably more of a need, but I did expect this given all of the easements we just did. You all set, I think?
On this project, yes. Yep.
So this is specific to this project, so you kind of budgeted not total budget, but just this project?
Yes, it just reflects we're trying to put expenses and these type of things just more clearly within one big project, so we can track them. And this was not under that structure. So Union Street is our first TIP project, and there were a lot of costs that were not budgeted when we entered into the agreement. I mean, it was so many years ago. So.
Okay. Makes sense, and I'm glad we're tracking it so we can see that and have a good audit of these things later on. Councilor Peaks, Councilor Denham, Councilor Gomez, any questions?
No questions on this one.
You all set, Kai? Omar, you all set?
Yeah, I'm good.
All right. So this is easy. I'll ask for a motion for a supplemental appropriation of $20,000 from the cannabis account to the legal advertising account.
So moved.
Second.
You have a motion on the floor. Any further discussion? Hearing none. Councilor Peak.
Aye.
Councilor Denham.
Aye.
And Councilor Riss says aye. Last one is Karen, Dr. Kamahart, you're up. More IT needs. Do you want to explain them? Do you need to have your mask on? Are you in the building?
Yes. Yeah, thank you. No, I just left. This is actually to supplement the IT budget. The budget of this year was a copy of last year. That was just an estimate of when we separated the IT of the school and the city, and there are many things that were not accounted for. In addition to new services that we are using, and I don't know if you want me to share some of these numbers or be more specific.
No, it seems to be, and I'll let the counselors ask questions. This is just like the fire department. You're supplementing your operating budget because it was short, because at the time we weren't sure where we'd be, and the mayor chose to take this route and use free cash and other reserves to fund the budget. I don't have any questions. It's obvious to me. Councilor Peak, Councilor Denham, Councilor Gomez, any questions on this?
I mean, just for the minutes, would you mind just giving a really quick description of what the unforeseen things were?
Yes.
Okay.
Yeah, absolutely. So we have 11,000 allocated for the account where we pay software and support. The most important one, we purchased backups on the cloud, and we pay for those monthly, $650 a month. So it's that amount for 6 months that we are requesting this here. So on top of having our backups here, now we have them on the cloud, and if needed, we can run from the cloud all of our services. So I think that was fundamental to put in place. We also purchased Virtue, that are hoping to get Virtue in place. That is an encryption software that we only purchased 25 users that we need for health and for other offices around HR, the police. The chief sometimes gets documentation from the FBI and he needs to distribute those across his department, and he needs an encryption. And the minimum amount of accounts that they sell you is 25. So we bought that. A paging system for IMC that was needed to connect our IMC with the fire department. Those are little amounts that were not accounted for when we pay for IMC.
What's IMC?
IMC is the current police software.
Okay.
So the main software was accounted for, but then there are all these pieces and fees for different modules that were not accounted for. We also needed to buy a new copier. That was an expense. So we actually bought two, one for the clerk's office and one for downstairs. And that copier has the capacity to do color because and it's less expensive because it's being maintained by United Business Services, and they charge us per copy a less amount that what cost us to print using our own printers and toners. So it seemed to us that that was a good investment to change that because we just couldn't keep up with the cost of toner. And the rest is to support, hopefully when the internet comes, we want to have that budget available to pay for the internet. And that we're hoping that that connection will be in place. And the rest is money just to support our regular expenses of a monitor that fails, a computer that needs to be replaced, paper for the printers.
Okay, great. That's very thorough. Thank you.
Thank you very much. Anything else, Connie or Omar? Nothing?
Just, can I say something?
Oh, who is that? Omar?
Me. I mean, my camera is not working. I don't know why. So,
Okay.
First, I want to say that I think Karine is doing an amazing job. Her department is doing an amazing job. One of the things, plus she's doing an extra job because with the permission of the mayor, she allowed me to go to Karen to change a few things. One of that is the agenda. Now you can translate it in our website, and that is amazing. So I can testify that team is doing amazing, and I hope we keep Karine for a long time because she's doing an amazing job. And for the record, after these two appropriations, the free cash balance is going to be $1,596,103.44.
Well, I was going to ask that question, but thanks a lot. Jen, you're off the hook. So $1,400,000 left in free cash. Okay. Anything else for this particular appropriation? Okay. Therefore, I would like a motion for a supplemental appropriation of $32,254.21 for various items for the IT department transferred from free cash.
So moved.
Second.
We have a motion and a second. Any further discussion? Hearing none. Councilor Peak.
Aye.
Councilor Denham.
Aye.
Councilor Riss says aye. The last item I want to discuss tonight is the pay plan. We had discussed last time. I think we had a consensus, councilors, and I want you to refresh my memory, that we did not feel that grade changes were in order, given that we paid for a Collins report. And this counselor is not ready to make any grade changes, but we were going to look at the pay scale. Am I correct in that assumption that we are okay without making any grade changes at this time? That's Exhibit A on the pay plan.
Right. I mean, I guess what I would say is on a case-by-case basis, if there was somebody in the city who felt that there was a position that really needed a grade change, I'd be interested in hearing about that, but nothing immediately jumped out to me. Obviously, though, like the world has changed in important ways since the last time. So, like, I mean, I'd be open to that, but I didn't hear that from anybody last time. That people were talking about issues with retention and the grade scale and whatnot, but I didn't hear anybody saying necessarily that like a whole lot about making any major changes to the positions grades themselves.
And I had a discussion with Emily, and Emily, you can confirm this, but grade changes to me require a great deal of data and information before we can actually move that way for anybody. That's correct? You're shaking your head. Okay. Connie, and then Barb.
Yeah, I do think that I heard that in order to remain competitive, some of these positions, I think we need to rethink the the pay grade. So, at some point, I think we do need to think about that, because if that's the case, then we're not going to get highly skilled people working in the city, et cetera. And so I think that that's just something to acknowledge. And I want to respect that was pointed out.
And I think that's achieved through the pay scale. There's two things here. There's the grades for each position, which is researched and Collins Center looked at. And then there's the pay scale, which we are going to look at tonight. That's Exhibit B. Barbara.
Okay, so I know that you all know that I've made it pretty clear that I'm not extremely happy with where my position sits, as more and more staff positions are filling into the same pay grade. I understand the Collins Center report, was expensive and did a lot, but I've also spoken to other clerks that have had the Collins Center at the same time, and the grades of ours vary from what other communities have for the same position compared to the same other positions. I've talked to Emily a lot about it. I've talked to Dan. I've mentioned it to Nicole. I think that as new positions are being added onto the pay plan and department heads are being put with staff positions, I think it's something to really think about. I understand that it's, it needs to be carefully done. Maybe job descriptions need to be looked at again, and we need to think about it. Look, do a little comparison with other communities, find some data. But I don't think this should, I'm not going to let this be forgotten. I think it just needs to be looked at. If we don't have to talk about it right this minute, but I want to put it out there that I feel like, there's 3 department heads that are now being put where staff positions are. And I think it's at least, it's owed to our positions to look at us, to make sure that our positions are being properly graded and that we're valued. Because, sometimes when I look at that, I feel like I'm not very important, like that my position isn't being valued at the same level that others are. And I don't think that's a good thing. So that's
all I'm going to say to that is that this counselor does not have the information that I would need to make such a determination. So that kind of a study, if Emily, you come up with anything regarding that, we should look at it in the future, but I don't agree that we should do it at any time at this time. So, because I'm sure there are other people on the pay plan that have the similar complaints. I believe that Exhibit B, the pay scale, is some way we could help. Mayor.
Yeah, I would just remind Councilor Rist and the legislative body of government, while they do appoint the city clerk, the assessor, and the auditor, it is an executive function to set a pay scale and a plan and present it to you. I have no intent to change what we have in place now. I think that there's something much more serious going on around inflationary deficits that have gone on historically when we had people on pay plan that did not get increases for sometimes as long as 8 years, or COLAs that were under inflation. I certainly hear what the city clerk has to say to compare pay scales and whatnot to other communities. We have done that. It's almost as if I can go out and find a pay scale in some community in Massachusetts, and it looks like everyone in the city is overpaid by 10 grand. I mean, that's just the reality of it. And I also would say that it's inappropriate for 3 people's salaries or what they're worth or to be addressed by a finance committee because it's a whole pay plan. And regardless of who you report to or you're appointed by, it's something the city has to look and its totality, and we have. And the one thing that comes up again and again and again is we have a pay equity issue. We have an inflationary gap that we will not make up for the people who have worked here for more than 5 years. That is a sad reality. The fact that there are department heads coming in at much more money does feel stinging, I'm sure, not only to the assessor, the auditor, and the city clerk, but also to the tax collector. And that is a reality of where we are right now. It's not that a position is disrespected. Additionally, some of these departments, and we were recommended to take them out when the Collins Center came out, additional stipends or additional duties, and that those were all able to happen in the person's regular workday. And because of the inequity and the longstanding lack of pay to our city employees, we put that to the side. We are facing what every city in Massachusetts is facing under a town or small city government, of not paying. The expectation that we're going to make over 20% up in a lowball estimation of inflation over the last 20 years is not reasonable, and it cannot be done. There are other, solutions that you will see in my budget proposal for this coming fiscal year. No pay plan schedule, grade. I have worked a lot of places with a lot of employees, and no pay scale. It's outdated the day you put it on the street.
I would tend to agree, and I would like to go to Exhibit B, because I believe that's something that the mayor has put forward. I'm going to show you this. This was given to me by Emily. This is a Exhibit B pay scale of 12 steps that goes effective July 1st. That would be in the mayor's budget. And it shows a 3% increase per step. I welcome this. I think it's a great first step. The only debate in my mind, we had asked, by the way, councilors, and we did get, and I sent them to you, 2% increase in 20 steps. That seems to me to be ridiculously too long. And I also asked for 15 steps, in a sense that maybe this would make us more competitive if we had a little bit larger range for each grade. So the debate in my mind, and I could go either way, is whether 12 steps at 3% or 15 steps. And I'll show you a different one, a different share here if I can. You don't see this, do you? All right. Do you see this? Hold on. This is 15 steps at 3%. Thank you, Emily, for putting this together. So I'd like to hear where we are with this. I am, in either case, these are ordinances. So if the mayor wants to put it in as a 12-step Exhibit B, we have to put it forward first and approve it as an ordinance change effective July 1st. So that's where I am on this. Councilors, mayor, anybody want to discuss this? I like the 15 steps myself, and I'd like to hear from people. Councilor Gomez, I think this was mentioned at the last meeting, but this is the only thing that I feel we should move on this evening and move on this agenda item. I agree with the mayor. Looking at each of those grades for our own positions is not appropriate at this time. Anybody, 15 steps or 12 steps, 3% increases. This is this is a little bit higher if you looked at the other one than 12 steps. Well, here it was 20 here. It goes to 21. If we stop at 12 steps, this column is where we'll be. Emily, do you have any comment on this?
Not really at the time. Like, I think it's maybe something to consider, but I think it's just something to look at. I don't know. I don't have any definites. Obviously this is something with the mayor, and also, a discussion with the Collins Center people about their opinions before we would move forward with anything, I think.
Jen, you raised your hand, Jen.
Yes. So this is kind of off the topic, I guess. It is this topic, but you had also asked us, Emily and I, if we could let you know what this change would cost. And, without taking every position that's a pay plan position and figuring that out, we're not going to get exact numbers, but I did some quick and dirty math, and the proposed 7.1, which Emily, that's 3%, right? Okay, so 3% above where we're at now. So given the pay plan employees, that would be about an additional cost of $80,000 over the course of the year. Okay, so that just
And that's for the 3% with 15 steps.
well, no, that's the 3%. Keep in mind that even with 15 steps, you still have the same number of employees, and we're all still at the same step if this were to go into effect. Where this chart would change things is when our step increases happen every January.
Right.
You know what I mean? So
Yeah, okay.
initially the money would be the same, whether it's this one or that one.
It just means that if we increase it to 15 steps, those that are at 12 on January would get another step increase if we passed 15-step Exhibit B, correct?
That's correct. The only thing I want to say to that effect is my only, I guess, word of caution on that is I don't know that it would combat the inequities that Barbara was kind of discussing, only because, yes, she would have 3 more steps. But what happens is when we're hiring new people, we have to be competitive. So that doesn't necessarily mean that someone's going to get hired, as a department head and make, if I don't know how long Barbara's been here, I'm sorry, but like say, a department head's been here 8 years. Logically, they've gone through 8 steps. It doesn't mean that a department head coming in is going to start at step 1, because that's not necessarily competitive. So, I think it's kind of like 2 different things, like you were saying. Like maybe if we do need to look at, certain positions or revamping, something about the Collins report down the road, maybe that's another discussion. But I think that as far as this chart goes, the only caveat is that yes, people who are maxed out at their 12 will continue for the next 3 years to get step increases.
Well, there's another thing in here too.
Mm-hmm.
To me, it's in the sense of recruitment. If you do 15 steps, you have a larger scale. And the mayor, when hiring, can look at that and maybe hire someone because they're very experienced for a department head at a step 10. Well, they still have 5 steps to go. But to be competitive with other cities and towns, she might want to hire that person at that step. Whereas if we kept it where it is, there's only 2 more steps of growth, and that might influence the person we're trying to recruit. So I'm only looking at the large picture, so I have no idea if it's a better route to go, but I thought in the sense of recruitment, it might give us a better range. Emily.
I guess my concern would be that we're going to end up in the same situation where we're hiring people at step 12 or 13 when other people are still, have been here and are at step 8. Like, it's just going to be like, looking at this more, it's going to be the same situation, just expanded is what's going to happen. So, I mean, I like the mayor's vision of looking at the 3%. And then I agree that it'd be reasonable to kind of look into positions and see where they're located and make sure they're in the right grades. But I don't know. I agree with Jen in cautioning as well.
So keeping it at 12 steps, but going to 3%. That still has to be passed, even though it's effective July 1st. In other words, it can't be just passed in the budget. The budget is one thing. An ordinance has to be passed to make it a 12-step 3%. I have no problem with keeping it 12, but I'd like to hear from other counselors. Let me go back to that one too. This is sorry. This is the one that was proposed by Emily, and I think the mayor's considering. Anybody, counselors?
Sure. I would just say Yeah. I mean, the differences between these various plans are fairly small. I don't feel like I have a basis to necessarily say which one's better than another. But what I would just say is that, and it sounds like the mayor's extremely aware of this, that, you know, the economy and certainly the labor market are in a extremely different place in many ways than they were when we last brought the Collins Center in. And that is just sort of how it is. You know, certainly if we were to retain the Collins Center again, then by the time their report came out, you know, it could be that the Fed raises interest rates and the whole economy tanks. We've got 12% unemployment. So we just don't know. But I would just say that it's just something to keep in mind that, we come up with these plans and then sort of like the mayor said, like the moment that you put them into effect, stuff starts changing. So, I'm aware that we have some budgetary constraints that are going to limit the amount that we can be responsive to this stuff. And that is what it is. I just also think we should just, continue to talk about this stuff and have conversations about it, because I do see, a potential, and I'm sure everyone's aware of this. Most people here have mentioned this before, but I do see a potential threat where we are seeing, an increasing number of older people leaving the workforce right now, which is a substantial share of the workforce, and bringing in people to fill those jobs, is going to require making sure that we are competitive. So in terms of what we vote on tonight, I'm fine with the mayor's proposal. I just think this is something that we should just keep our eye on.
Mm-hmm. Yeah, I'd like to. I'm happy to go with this proposal and get it. I'd like to get it off our agenda, only because I don't think we can go further. I think the mayor's right. There's so many parts to this. I think this is a great step toward pay equity, as the mayor said, and the mayor has her hand raised. Mayor.
Thank you, Chair. I was just going to ask for the moving forward in a positive recommendation on the scale that's in front of us, 12-step 3%. I think it is a start. I sorely hear, the concerns of the city clerk, as well as other employees who do not, who aren't appointed from the city council. It's really quite a predicament. I think that pay equity is a really big issue in these jobs in particular. But I would also say it's cold comfort to today, but folks who have acquired or gone up the steps also, after a certain number of years, are contributing less into the pension because the years into the system. So there's a opportunity cost there, as far as there are more pension dollars of folks who've been here longer in a pretty well performing pension fund, and somebody coming in at a higher rate, or coming in at an 8, as for the first time, is putting in more money, and more money that is affected by inflation is worth less. So, there's a lot of things to consider. And I'm not lessening anybody else's concerns, and we're, but I would, just to line up budget stuff to have this go forward with a positive recommendation, what we're looking at here, which is 3% over 12 steps.
I think it is a positive move, a very welcome move. It gives us a better range. It gives those that are on 12 right now will get a little bump, because there's a change when the budget comes around. I like it. Councilor Denham or Councilor Gomez, any comment?
Yeah. I was just going to say, I'm fine going with 12. I would prefer 15. I just think that it's there is a pay equity issue, and I think the more that we can do to support people who work in the city financially, I think that's just out of respect to work that they're doing. That's just my personal opinion.
Councilor Gomez, any comment? Oh, Mark, I guess not. At this point, the other thing to consider is the fact that it's $80,000 come July 1st increase in the budget. The 15 steps wouldn't change that. So we need to remember that. It just means that people will go further. Barbara?
All right, I just want to say that this is good, but does it really do anything except give a 3%? I mean, it's still if I'm at 12, come January, I still don't have anywhere to go. The 15 at least gives a little room to go somewhere besides just a COLA. I haven't had a step increase in, I don't know, it seems like it's been forever. But it doesn't, this is good, but at least I think the 15 at least gives a little more room, and you're not like, people aren't hitting the ceiling just as soon as you vote it. But I just wanted to say that.
I could go either way, frankly. I like what Connie said, but I also like what the mayor said. As I said, this is effective July 1st. So 12 steps or 15 steps, I've heard both arguments. I'm wondering if we can't vote on this the next meeting. What we'll be voting on is Exhibit B, whether it's 12 steps or 15 steps. Do you agree, councilors? Maybe we can think about this for a little while longer, although I'm happy to vote on a 12-step tonight, and maybe we look at 15 steps next budget year. But I could go either way. I'm wondering how you feel about just delaying a vote until the next meeting and we think about it further.
I would want to better understand the implications of that in terms of the budgetary process that the city's undertaking. Would there be any negative consequences for us delaying for 2 weeks?
No. Mayor, you'd like us to get this out of the way?
Yeah, I mean, we need to get this through the process and into ordinance. And we have a very full schedule of stuff that we'll be bringing to you. We're working on a legislative schedule or executive branch schedule with President Gomez. I would just be afraid that this will get lost in what's coming.
It doesn't have to go to ordinance. It's just, the finance committee has always approved pay plan. So if we vote on it tonight, it goes right to public hearing. That's what's going to happen if we decide.
It's I defer to the thoughtfulness and contemplation of the committee. I would just, this is the structure that works for what we'd like to put together for the budget, knowing that we have other compensation issues to address in other departments. But I don't know, Jen? Might have more to say about it. I'm not.
Well, I actually just, and I hope I'm not speaking out of turn, Mayor, but Mayor and I have, and Emily, we have had conversations about this. And like, I also think that, choosing to vote the 12 steps, 3% for, effective July 1st, that doesn't mean that, okay, we're done, everything's fine, we've established pay equity and now we don't have to look at it for 5 years. I mean, that's not, I think this is a first step in trying to achieve pay equity. So I guess what I'm trying to say is, if you like the idea of the 15, maybe that's something that we talk about, as part of the change going forward. But I think that this isn't the be all and end all.
I would agree. And I have to say, I put all this forward to answer a question and to get a discussion. And I like that we've gotten to this point, but the discussion never has to stop. And secondly, the mayor and Jen and all of you that work in City Hall, all the pay plan employees, you're the ones who are discussing this all the time. And you have much more of a feeling of what would be best for the city. I wanted to get a discussion. I'm very happy we've gotten to 3% at 12. Even at 12 steps, I would be happy to vote for 15, but I think right now, let's vote for 12 tonight. That's my feeling. And that we can always bring up increasing the steps. And perhaps the mayor and Emily and Jen will bring that forward next year. But as I said, I think they have a better handle on the metric that they have to look at all the complications of the pay plan. That's my feeling. Mayor, you have your hand up again?
I just want to put this in too. I mean, the correction of or the realigning of this grade and step system is just pretty antiquated. We have job descriptions on here that really haven't changed since the beginning of us being a city, not because good or bad, an auditor is an auditor and whatnot, but the nature of the job has changed. I mean, I think that there's really a strong look to be taken at job descriptions and not updating them by adding the bullet points of what people do, but looking at it as the type of independent work or leadership and not just the function of the job. And that is a very time-consuming process. And we're fighting to retain people, but I think that that's another kind of systemic issue. You're really look at the list of jobs here, and they are, classically done by women who want a lighter schedule. And those job descriptions, even though we've updated them, that language, that gender bias, that ethnic bias is deep embedded. So, I mean, there's definitely a lot of work to be done here. And I'm glad the conversation has started. But as far as this doesn't really get to where we want it until we go all the way back and take a look at what people are doing and the strength that they're holding. And not that anybody's being paid too much, but it gets us to a more realistic step and grade salary. The last thing I would add here, a lot of cities are discarding this form of pay for over a certain amount of money for personal contracts based on the person. So auditor and treasurer, it's very common. I don't know about clerk and assessor, but you negotiate just like we do with the police chief or the deputy chiefs. You negotiate a personal contract. So that's another. And then, these steps would reflect kind of entry level going up to, just right before management, however that is.
Non-department heads would stay here maybe in the future, and contracts would be head out for department heads or something. That's a major discussion.
I just know when I've asked other cities how they have dealt with the exact same, things that Barbara has brought up, they're like, why aren't you doing personal contracts? And I was like, I don't know. I mean, sure. I just didn't know that. I mean, the auditor legally can have one, but other cities are letting go with that. And I do have an email out to DLS about what is considered a modern structure of how people report and their functions and skills and pay and how people are paying them. But I wanted to get this 3% into this next budget with the hope that there would be another COLA in January, as it was this last year, to just trying to backfill. I mean,
I like it. And just to say, I've been on the council for a long time, 25 years. I've never liked this pay plan. I think it's inequity. I think it stops everybody at 12 steps. Collective bargaining units, their longest term employees still get their contract increase if they negotiate it, whereas a person who's at the 12th step is stopped. Mm-hmm. That always concerned me. But it's also beyond my pay grade to make those kinds of decisions. And I know the mayor is very sincere and concerned about this. So I think I would await for hopefully soon some thought on what we can do moving forward. But for tonight, I would like to vote on an approving and putting forward for public hearing an executive, this Exhibit B, 3% 12-step increases effective July 1st. Does anybody disagree with voting on that tonight?
That's fine.
Tom, you okay with that? Connie, okay with voting on this tonight as a first step?
Yeah, I'm totally fine with that. I think the only thing I want, you know, in regards to what the mayor said, I just want it to be fair, right? And so I think if this is a first step, that's fine. But, you know, if things need to be rewritten, et cetera, then I'd like to see that process begin, because I do think there is an equity issue given, just based on what she said around language, et cetera, gender equity, race, gender, all of that. So I just want it to be fair.
Also, the Collins report was, what, 4 years ago? So, yes, things have changed. So can I have a motion to approve the new Exhibit B, effective July 1st, 2022, showing a 3% increase over 12 steps?
So moved.
Second.
We have a motion before us to approve the new Exhibit B. Any further discussion? Councilor Peak?
Aye.
Councilor Denham?
Aye.
Councilor Riss says aye. I will put this forward for a public hearing. Barbara, go ahead, Barbara.
Now I'm just talking about the process for that because nobody on the council has seen this. It hasn't come before the council. And so if you're going to schedule a public hearing next week for the first, when are you thinking about the public hearing?
It's going to be 2 weeks. It's going to be 3 weeks from yesterday.
I mean, do you want to bring this forward?
We're going to bring it forward next meeting because it's on our agenda. We put it on the agenda so we can bring it forward and show the council. They'll have 2 weeks to study it.
Okay, so what date are you thinking about for the public hearing?
The first meeting in March.
Okay.
March 2nd.
Okay, so
and you would put it in the proper language, you know, like you did when we did the COLA.
Yeah, okay. I know I have to advertise this. I mean,
Is that enough time? I mean, if we ask for public hearing, it's like normal next Wednesday.
But usually it's already, it's gone to council as an ordinance, you know, like Emily would send it like, here, this is the motion and this is the proposed Exhibit B. And then.
I don't see why we have to wait another 2 weeks. I'd like to get this done another month, then it'd be a month.
Okay, so I'm just wondering when the council is going to see it for the first time.
Councilor Gomez, are you still on?
He is, but he just texted me saying his mic is broken.
All right, I will ask for Councilor Gomez to give us a
I could
amended agenda for Monday that includes this for consideration.
Okay, could you send me a memo and this Exhibit B? Send it to me and I will amend the agenda. I mean, I can even do it tomorrow if you get it to me.
I'll get it to you immediately after this meeting. I'll send you this exhibit and I'll send you, just please have this on the agenda.
Okay.
And I'm sure Omar would allow it so we can get it done within the period. Although I wish he was, if he doesn't agree, he'll call me. All right.
Okay. Dan,
that's where we're going to be.
Dan, do you have the wording? Well, there is a specific wording for a pay plan increase. We just had one.
We use the same chapter and verse.
Right.
The only difference is effective July 1st. Okay.
Do you want that for your memo or do you want me just to put it in?
Just put that in. I'm sure you can do it. You're matching what the COLA was.
Yeah.
Except that this pay plan will be included. Okay.
Okay. All right. Send it to me.
Omar says he's fine with it.
Okay. I will amend the agenda.
How come he's talking to you and not me?
I don't know. Maybe you trust me better with cell phones.
All right.
I'm just kidding, Dan.
It's all right. It's okay. So is there anything else? We will try to begin discussions of the review of salary and stipends next meeting. I gave you a lot of information and we'll start discussing that. We have time for that. Anything else, councilors? Otherwise, I'll take a motion for adjournment.
So moved.
Second.
Motion to adjourn, Counselor Peak.
Aye.
Counselor Denham.
Aye.
Counselor Riss says aye. Thank you all. And we'll see you when we see you.